Hello.
Oh no, it's not gonna work. There it is.
Hello.
Hello. Hello everyone, happy Tuesday.
Happy Tuesday. Hope you guys didn't eat too much turkey.
Yeah. Perfect. Let's wait a few seconds for more people to pop on. How are you doing today?
Good. Everything's good.
Yeah,
Holiday
how was your
great.
tell me about that.
Yeah,
Just
nothing
relaxed.
much. Just relaxing with the family. Thanksgiving meal, turkey.
Nice.
Yeah.
Did you eat a lot?
Of course.
A lot of turkey.
And other stuff too.
Oh yeah, that's good.
Yeah.
Right. Hello.
You had a good one?
Yeah. Let's wait a few.
Did you
There's
cook?
No one on. So I'm like not American, so it's like.
You don't celebrate it?
No.
Oh.
So I was like, my dad came down from Canada, so we just.
Oh, that's
went around
nice.
with him. Yeah.
That's nice.
Hello. Right, there's 0 people on. It's weird. Hello, guys. All right, we are here with.
Dr. Dang.
We are here with Dr. Dang. Do you guys have any questions? If you guys want to go ahead and ask your questions here in the comment section, he will be glad to answer your questions. Perfect. All right. All right, guys, don't be shy. All right. And then go ahead and tap the screen, guys. Tap the screen. Send us love. There you go. Send us love, please.
Send us love.
The likes. And then if you guys have any questions, concerns, then please go ahead and let us know. I love icon, says Kobe's wife. There you go. Awesome. I'm glad
Thank you,
to hear
Kobe's
that.
wife.
That is great.
Thank you, Kobe.
All right, so we have a first question here real quick. A grandfather of devil. Hello. How much for a breast reduction? Okay, so we have amazing deals, but I will tell you that TikTok doesn't like it too much when we talk about our prices. So please go ahead and send us your full information here, full name and number, and then a coordinator will reach out to you, okay? Perfect. All right, so let's go ahead and get started with Dr. Dang. All right, Dr. Dang, how are you today? Did you have any surgeries?
We always have surgeries. Yes.
What is your...
We're in between
most
cases right
recent-
now.
Okay, awesome.
We just did a BBL. And BBL told me on the way.
Okay, very nice, perfect.
We're
So,
back from the vacation, so it gets busy.
right, awesome. So how does it feel to be back after your little vacation?
Awesome. It's like
Ready to work?
Yeah, because if you stay out too long, then you kind of get anxious about getting back to your normal routine.
Yeah, that's
And
true.
so yeah, it's
That's
good to be
true.
back.
Perfect.
Always
All right.
nice to meet new patients, new people.
Awesome. All right, so let's go ahead and get started, guys. Like I said, if you have any questions for Dr. Ding, go ahead and ask them here in the comments, and then he will be responding to them. All right, let's get started. Dr. Ding, I have a BMI of 25. Is this a risk for me to have a procedure?
No, you are that's a perfect BMI. I mean, anything below 25 is perfect. And so, no, that's not a risk at all. We only get concerned if you're a little bit too high, like over 30. That would mean that you're in the obese category. But, I always say I don't really go by the numbers. It all depends on the patient, how healthy they are. And so, even if you're 35, 36, 37, if you're healthy otherwise, then you would still be a good candidate.
Right. Perfect. So BMI is not really...
It is important for consideration, but it's not all. With medicine, with anything with medicine, you can't just depend on one thing. And so you have to evaluate the person as a whole, and not just based on the number. That's my philosophy anyway.
Perfect.
Right.
Awesome. Thank you. All right, so let's go on. All right, so Dr. Ding, I have low iron levels.
Yeah.
What should I do to raise them, and what do you recommend?
I would recommend, number one, get a workout and see why you're low to begin with. A lot of female patients who are still having periods and they tend to have heavy periods that can be a cause, or other gynecologic issues or other issue with your blood. So I would get that checked out first. Otherwise, if everything else is normal, just I would suggest taking iron supplement. I would do a few months before any planned procedures. Okay, that will help to kind of keep up your iron, get your body to produce more blood cells. But even if you're borderline normal, then we can always add in cell saver. Basically, it works is when we do the liposuction, we collect everything, and whatever blood that we lose, we put it back into your body. So that's a good option if you're a little bit like borderline normal. Okay.
Perfect. What was I gonna ask? So, is having a good iron level important? Why?
Definitely important because our surgeries are elective, meaning that you elect to have this procedure done. It's not like a procedure that you have to have as a life-saving thing emergently. And so you want to be able to recover well, right? You're doing this for certain reasons, and you want to heal well so that you can look good and feel good. And so it's important to be optimized. And one of the optimization is to get your blood level up. Right?
Perfect. Awesome. Thank you so much for answering that. Guys, if you guys have any questions, go ahead and ask them here in the comment section, and then he will address any concerns that you may have as well. Perfect. I have hypertension. Will this affect my procedure?
If just hypertension alone, usually we'd ask for medical or cardiac clearance just to make sure your heart's okay. If you're a younger patient and you have hypertension, that's the only thing. It should be okay as long as you're cleared by your primary care doctor. Now, if you're obese, hypertension, diabetes, then that needs to be worked up and cleared. But we've had a lot of patients with hypertension, and as long as we do the due diligence, they do just fine.
Awesome.
Okay.
All right, thank you so much for answering that.
Yeah.
Okay, so I'm wondering about the recovery after my mommy makeover. How soon can I go back to work? I work in an office setting.
Okay. If your work is not too strenuous physically, you can probably go back to work within a month or so. Okay. But technically, going back to normal life is gonna take 6 to 8 weeks at least. But going back to work, I would say a month.
Perfect.
Especially if it's office setting and it's not something strenuous.
Right, so it depends on the kind of work that they do, all of that.
Yeah.
All right, perfect. All right, so Dr. Dang, I'm a male and I lost a lot of weight, but I still don't look like before, look like what I looked like before. Do you recommend any certain procedure?
That depends as well. We do have a lot of patients with a lot of massive weight loss, especially with weight loss surgery or with the current Ozempic medications. A lot of patients we deal with, they have a lot of weight loss, and so it depends. If you're talking about excess skin in your belly, then we can still do a tummy tuck on a male. If you're talking about excess skin on the arms, or you have breasts that are saggy, then those can be addressed too. So it's not just for females, everything is applicable to everybody.
Awesome. And then you touched on the tummy tuck. Do you want to explain that really quickly?
Tummy tuck is a pretty common procedure we do. A lot of us, when we get older or lose weight, then we have a lot of excess skin in the belly, right? It's the belly that you think is fat that won't go away. So the only way to really resolve that is to cut out the excess fat. And so what we do is so that's when you have the long incision across just above your pubic bone. And then we also go underneath the skin and the fat layer. We get access to the muscle underneath that you can't see, the muscle that will give you the six-pack. And we also tighten it up too. If it's spread out, then we can tighten it up. And then cut the excess skin and put everything back, pull everything down so that it's nice and tight, and put it back together.
Awesome. So I wanted to touch on the tummy tuck because Dr. Dang has a Christmas special as well as this one.
Oh, that one. This one too.
This one too. He has a lot of specials for Christmas, so take advantage, guys. If you're interested in a tummy tuck, Dr. Dang has his tummy tucks for Christmas only, okay? 3,500. Starting at 3,500 for a tummy tuck. So if you're interested, go ahead and send a message there, full name and number, and let the coordinator know that you want a free consultation with Dr. Dang.
Yeah.
Perfect. All right, so
It doesn't hurt to get a consultation. We're always available.
Of course. So get that free consultation. So we have a few questions here on TikTok. We have, if I want to do a lipo alone, can I go to work after 1 week? Is it possible? Thank you.
I think it's possible. You still have to wear your garment, your faja. But if you feel good enough to go to work, I think that should be okay.
Perfect. How important is that faja or that compression garment?
Very, very important. It's actually part of the surgery. You know, you can do the best surgery, but if you don't follow the instruction and wear the garment, then it can be all for naught. So make sure you wear the faja. Okay.
Very important. Awesome.
It's uncomfortable, but beauty is
it's worth it.
It's a good trade-off.
It's worth it. Exactly.
Yeah.
All right. So we're getting a few questions here. That's awesome. So on Instagram, how should I sleep after my tummy tuck with a BBL?
We still do the same thing if you only have a BBL. We still have to sleep with the belly down, with the pillow on your chest and another pillow on your thighs. It might be uncomfortable, but people get used to it. Okay.
Of course. Awesome. Thank you. All right. So we have Odilon. Sorry, I totally butchered that. I'm looking forward to my surgery, July 2025.
Wow, that far down? Awesome.
It's gonna be here in a blink of an eye, honestly. Like, it's already December? It's crazy.
Yeah. Look forward to meeting you.
Yeah, can't wait to see you. Awesome. All right, so we have here Boss Lady says, what does your A1C have to be?
Typically we want to be at around below 7, because 7 is considered controlled. And so, yeah, I would say 7.
Perfect. All right, guys, thank you so much for the questions. If you have any more questions, go ahead and ask them here in the comment section, and then he will be addressing them.
Yeah. Don't be shy.
Yes,
we're here.
Do not be shy. He's here to help.
If we miss you, then we'll just answer them next time.
Of course. Or if you guys also want to send in your
us,
details, then he can answer your questions as well. Perfect. All right. Where can I see your results, Dr. Dang?
Go to the Icon Cosmetics Center Instagram page, or you can go to my page. You can check those out.
Perfect. Do you by chance know your handle on IG?
Dr. Kwok Dang.
Perfect.
Dr. Kwok Dang.
Perfect. And then I know he is tagged as well in the Icon post, so you can definitely just take a look at him there. Perfect. All right. So I don't know if I should choose just the Lipo 360 or get the BBL. What do you recommend?
That's why I'm here. To kind of give you the guidance. Depends on if what your goal is, right? If your goal is to look slimmer, then great. If you have a nice shape already, you have a nice hip, and you have a good projection of the buttock, then you may not need it. But if you have a little dips here and there, or if you want a little bit more projection, you want more hip, then BBL will be good. I do recommend at least some kind of fat transfer, whether it's a lot or little, to kind of help shape you a little bit better, because the first liposuction is the best to get the best fat, to get the best result, and so you want to kind of I hate to waste the good fat on the first BBL without doing any injection. But it depends on you, depends on what your goal is.
Of course. And then of course, guys, if you want to get that free consultation, he will be able to look at you and then guide you better. All right, so we have Lisbeth Ocampo here. She says,
Hi, Lisbeth.
hello. I have my surgery scheduled in March. How often should I do the lymphatic massages?
That's very important. Massages and faha, those two most important things, okay? What I recommend for the first week is basically every day. And then from the second week on, about 2-3 times a week. Okay.
Perfect.
The more you do, the better. But I would do at least 4 to 6 weeks.
Perfect. And great. Okay. And then, do you recommend they come to the clinic first so they learn how to do the massages? What do you recommend?
They do have a lot of medical massages that they can offer, or you can come here if you're from out of town, or you stay here as well. We do offer massage as well, and so once you come here while you're down here, then you can learn the techniques that they use. It's not hard.
Perfect. All right. Awesome. I hope he was able to answer your question, Lisbeth. Any other questions, please go ahead and let us know. All right. I am from Detroit, but I love your work. Do you offer virtual consultations?
Of course. Either just contact us and we'll set up a face-to-face meeting on the either FaceTime or Zoom or whatever you use.
Perfect. Awesome. And then we'll touch on that a little bit later. Let's see. Julissa here is saying, hello, I am scheduled for my BBL on March with you, Dr. Dang.
Hi, Julissa. Thank you for trusting me. Can't wait to see you.
That is awesome. We are super excited to see you. All right. So for her BBL, that's exciting. That's exciting.
Awesome.
So we were saying if you travel, what are your recommendations? Should you come with someone? Should you stay in Miami for a little bit?
I would plan to stay in Miami for about a week after your surgery date. That gives us, time to make sure everything's okay before you travel back. I would recommend that you fly and not drive. Okay, especially it's 5-6 hour driving. I would recommend that. I would recommend you fly. I would also recommend that you bring someone who can help take care of you after surgery. It's always nice to have family or friends to be around in case something happens. And someone to help you just with your luggage. When you have to put it up on the overhead compartments. You don't think about that, but that's important too.
That's very true.
Yeah.
Perfect. Okay, so Julissa here is asking another question. Sorry, she is asking, after her BBL, is there going to be a lot of loose skin if I am 156 pounds?
Julissa, it really depends on your skin. Let's say if you're a little bit older and you already have saggy skin or excess skin to begin with, it can cause more excess skin, okay, because all the fat you sucked out. But if you're a little bit younger and your skin is nice and toned, then sometimes it will be just fine, okay. Now we also offer, if we're concerned about excess skin afterwards, we offer J plasma. It used to be called J plasma. But it's a way to kind of tighten the skin after the liposuction so that your skin can be more tight. Does it solve everything? No, but it helps a lot, especially in the waist area where you want it to be tight, right? But that's an option too. When I see you, then we can talk more, okay?
It's not called J plasma?
Oh, it's Renuvion.
Oh, okay.
J plasma is the old term,
okay,
but the company now is called Renuvion.
Perfect. And then do you want to kind of explain what exactly Renuvion is?
Or J plasma?
The J plasma.
It's basically a device. It's about this long, and so you stick it under the skin where the liposuction incisions are. And basically what it does, it has gas and then it heats up the gas. Well, so when you heat up so basically it's heating up the skin from underneath, and you're promoting the collagen to be tighter, and so tighten up your skin.
Awesome. Okay, really quick, Dion says there's no audio. I don't know. Are you able to hear us?
But my audio is on.
So hopefully you're able to hear us. If not, go ahead and send their DM, okay?
That's
Send a
weird.
comment, and then we'll be able to help you. So hopefully everything is okay. All right, so we have another question here from Elizabeth Velasquez. She's asking, can we sit on the plane after a BBL or will it affect my results?
You can sit on the plane. You should have a pillow. And yeah, we have a lot of patients flying in and out, and so that should be okay.
Perfect.
Okay, don't worry about that.
How long should you use the BBL pillow? What is your take on that?
Oh, 6 to 8 weeks.
Perfect. All
So
right.
we don't recommend you sitting at all for at least 2 to 4 weeks. Okay, 4 weeks probably better, and then after that you use a pillow.
Awesome. All right. Very good. Elizabeth, if you are interested in booking with Dr. Deng, like I said here, go ahead and send us your full name and number. Full name and number, and we will get to you. Okay, a coordinator will contact you so you can get that free consultation with Dr. Deng.
Why do I have sound?
All right. So I saw a question there on Cell Saver.
Uh-huh. Oh.
If you recommend it.
If I recommend Cell Saver, it's patient dependent, but for the most part, I think it's a good thing to have. If your blood level, if your blood level is low, then definitely I recommend it. But if you're a little older patient with some medical issue, then yes, I recommend Cell Saver. Or just anybody who wants to feel better after surgery, then yes, it will help with that. It'll help with the recovery process.
Perfect. All right. We're having technical difficulties here.
You can continue.
That's okay. All right. So, Dr. Deng, do you use ultrasound for your BBL?
We always do. But it's the best way to avoid complications. So we always look at the ultrasound, make sure that where we're injecting is the right place to inject. That's always safe. Okay, we don't want to inject through the muscle, because that's where you get your complications.
Of course. Awesome. So do not worry, you will be in very good hands. All right. Perfect. I think I might want to get silicone implants, but I don't know what other options there are.
There are. Sorry. Oh no, it worked now. Silicone implants. Yes. So there are different types of implants, right? You have the main ones are silicone and saline. Okay. So depend on the look that you want, the shape that you want, then you can choose between the two. Now, silicone looks more natural, feels more natural. It can give you a high profile look that a lot of women want. Silicone is always a risk of rupture. That's like the history of silicone, right? But the new silicones are now very cohesive, and so even if it ruptures, it wouldn't be spreading around like it used to be. So the risk is much lower. So saline implant, even if it ruptures, it's fine because there's a saline inside, so it doesn't cause anything. The main problem with saline is that it doesn't feel as natural as the silicone, but the saline also has ripple. Like in a bag, the water in a bag, like a plastic bag, and you hold it up, you see like little ripple effects, and so that can show through the skin. But for the most part, both work very well. I don't have anything negative to say about each of them. And then within that, then you have like low profile, high profile. So there's a lot of different options.
Awesome. Okay, very good. And then speaking about breast augmentation, there you go. Okay, so we have Dr. Deng has this special for Christmas, guys, legit only for Christmas. Breast augmentation 3,500 for silicone. This is the silicone price, okay? So if you guys are interested, please go ahead and send us a DM with your full name and number. All right, perfect. So we have a few comments here in Spanish, but I'm going to translate them because they're awesome. Okay, so Carolina Hey, my name is Carolina too. She says, mi doctor el mejor. She says, my doctor is the best. All right, awesome.
I know Carolina. I remember.
Yeah, you remember her?
I still talk to her.
Okay, awesome. And then, of course, we have Roger. He says, my doctor changed my life. Thank you so much for a good job.
You're welcome, Roger.
That is great. Okay, that is awesome. Thank you guys.
I think I need a sleeve on him.
Okay. Thank you for letting us know that how your experience was with Dr. Dang. That is awesome. That is amazing. Okay. Carolina's from Colorado, she says.
Yeah.
She says hello. Perfect. All right. So let's keep going. Dr. Dang, I'm 50, but I've always had good health. Can I get a lipo 360?
Yes, you can.
What is your take on age?
Age? We always say probably 65 is the cutoff, but it all depends. If you're 65 and you're healthy, then that's not an issue. But if you're like, when you compare that to a 40-year-old who's got all health issues, that's a different story, right? And so, like I said, everybody, you have to judge a patient as a whole and not just on the numbers.
Awesome.
Okay.
Awesome. Very good. Okay, perfect. So, will we meet before the procedure?
Yes, you meet me before the procedure, and you see me after the procedure, and you see me at post office.
Awesome.
And you always have access to me, whether it's by phone or Instagram, whatever. You can always text me.
Awesome. So, like I said, you will be taken very
Yeah.
well. You'll oh my gosh, taken good care of with Dr. Dang.
All my patients, when they want to contact me, they can, directly.
Okay, perfect. Really quickly, we have Julissa says, I want to change my implants. I have saline to silicone. Is that more expensive? Okay, perfect. So please go ahead and let your coordinator know or send us a message here, okay? And then a coordinator will be able to discuss that in more detail. All right, perfect. All right, so.
Wait, yeah, she's the one, Julissa, she scheduled the BBL with us.
Oh, right, yes.
Yeah, you want to do it, we'll do it at the same time. Save you time and money.
There you go. Good tip.
Yeah.
Good tip.
Yeah.
So take advantage. All right. Is there anything I should avoid before my procedure?
Yes. I would avoid all the blood thinner medications like aspirin, ibuprofen, Motrin. Those are the NSAIDs. You want to stop those at least a week before surgery. And what else? Some supplements that can cause bleeding. Vitamin E can cause bleeding, so you take a supplement, make sure you're not taking vitamin E. Smoking, at least a month before surgery and a month after surgery, okay? And maybe never after surgery. Yeah, smoking's bad.
Hey, well, you stopped a month. Might as well continue that, right?
Well, 2 months before and after surgery,
Right.
It's like 2 months total. Hopefully, you can quit after that. What else? That's about it.
What about alcohol?
Alcohol? You can drink alcohol. It's okay.
Okay.
Just don't drink it the night before, though. You gotta be hydrated. Make sure you keep yourself hydrated. And yeah.
Perfect. All right. Very good question. All right.
Unless you're my sleep patient. If you're a sleep patient, you do bariatric surgery with me, then you can't drink.
Okay. For how long?
At least 6 months. It's empty calorie, and so if it's for weight loss purpose.
Right. That makes sense. Perfect. All right. Should I bring anything for the day of my procedure?
Day of procedure, a robe. That would be nice and comfortable for you. Make sure you bring some fluid, like Gatorade or Pedialyte. We like Pedialyte. That will keep you dehydrated. Slippers. I think that's important. Just to kind of keep your feet kind of clean. What else? medication. The medication you take every day. After surgery, you can start eating and taking your medication. That's important, especially if you have hypertension, high blood pressure. Make sure usually you take your medication on the day off. Okay, the morning off.
Awesome. Very good. Perfect. All right. So let's go ahead and ask one last question. Guys, if you have any last minute questions for Dr. Deng, go ahead and ask them here in the comments. And then, of course, book that free consultation with him, okay? Completely free, virtual or in person. All right, perfect. So last question here. I take Ozempic for weight loss.
Mm-hmm.
Do I have to discontinue this medication or what should I do?
No, you don't have to discontinue Ozempic. It should be okay.
Are you
Oh.
ready?
No, I mean it shouldn't. Ozempic shouldn't affect the surgery. You'll be okay. All right.
Okay, do you see that one?
Yeah. No, you don't have to wait to this. We do both at the same time. It all depends, but it all depends. I have to see you to really see what you need, because when you talk about implant, we may have to talk about breast lifts too if you need it. And so maybe that's why they're telling you to wait 6 months. Okay, but if it's just a simple exchange, it should be fine at the same time.
Okay, perfect. So hopefully, Julissa, that helped you out there. All right, so thank you so much, Dr. Deng. We always love having you here.
All right, very good. It's always nice to talk to everybody, see what the questions are, because I want to know what you guys are thinking.
Of
and
course.
What I can help you with. Okay. Any issue, any question, you can always contact me directly through IG. I answer them myself. And then you can contact Icon or the coordinators, and they have access to me. Okay?
Perfect. All right, so you guys know how to reach him. And then which location are you in?
I'm in Miami. Sunny Miami.
Perfect, guys. All right, so thank you so much, Dr. Deng. I
Thank you,
will
Carolina.
see you soon, hopefully again.
Yeah, it's been fun. We'll do this again.
Of course, of course. All right, thank you so much. I'm going to keep going, so I will let you.
Bye, everybody. I'll see you guys next time.
All right, let's give a few seconds here. Thank you.
You're welcome.
Great.
Good job.
Thank you so much. All right, guys. Hello. Let me get centered here. All right, so I hope you guys enjoyed that with Dr. Deng. I know he's very amazing at explaining everything, at answering your questions. So let's leave this here. All right, if you guys have any other questions, if you guys want to go over pricing, if you guys want to talk about this giveaway, okay, we're going to talk about this giveaway. If you guys want to talk about anything in particular, please go ahead and let me know here in the comment section, and I will be able to help you. All right, there you go. Let me fix this. I'm trying to see how. No, this way. Perfect. All right, you guys can see that here. All right, guys, so let's talk about this giveaway. We were talking about it yesterday, how today is the cutoff. Okay, today is the cutoff for this giveaway. Today at 3, the winner is going to be announced. Okay, so I hope you guys entered. I've been telling you guys to go ahead and enter on our Instagram page, just following the instructions on our pinned post. Super simple instructions. So hopefully you were able to enter in the giveaway, and good luck. Like I said, today is going to be announced who the winner is. So I hope you guys were able to enter. If not, hurry right now. Like, hurry right now. Go ahead and go onto our TikTok. You will see in the bio a little Instagram button. Click that. It'll take you directly to the Instagram page. On there, you will be able to see the pinned post. That is our giveaway, okay? So you're going to enter. by following the instructions, just tagging us, tagging 3 friends, following our accounts, and then just sending us your information. That is it. Super, super simple. And you can win a free procedure, all right? So completely free procedure. That is amazing. Who would not want to win that? Like, that is amazing. So take advantage, guys, because like I said, at 3, the giveaway is going to be announced, the winner. The winner is going to be announced, so I'm super excited to see what happens and who wins. I'm super excited, so hopefully you guys stay tuned for that. We're going to be doing a live at 3 when the winner is announced, all right? So stay tuned for that, guys. I hope you enjoyed talking to Dr. Dang. He has amazing Christmas deals, as you see here. He has his breast augmentation with silicone. This price is silicone, $3,500. And then he has a tummy tuck as well for $3,500. And then if you guys are interested in saline, it is at $2,800 starting at with Dr. Dang. So hopefully you were able to see Dr. Dang right now. A few minutes ago, he was amazing, like always. He's great. He's very informative, and he loves answering your questions. So hopefully you guys were able to join and then of course see that. So if you guys have any questions for me, I am here to help you. So go ahead and ask me. If you didn't ask Dr. Dang, or if you're just joining in, please go ahead and let me know in the comment section. También hablo español por si están allí, si están tímidas, si no saben si hablo español, tranquilas que sí, les puedo ayudar en español. Entonces envíenme por favor sus inquietudes, sus dudas, sus preguntas, y aquí voy a estar para ayudar y para guiarlas, ¿vale? Alright guys, so we talked about the giveaway. Okay, so we have new deals, guys. We have new specials, new Christmas specials. As you guys know, it is December, right? Time is flying by. It is already December, and we have amazing deals for Christmas. Okay, this is awesome. For Christmas, we have amazing deals with each of our doctors. If you guys want to know about a certain procedure, please let me know. We have, for example, let's go through the doctors and their specials for Christmas, right? So if you're interested in Dr. Moradian, he has a BBL special for Christmas, as I say, starting at $5,000. All right, so these are just deals for Christmas, guys. These are just deals for Christmas. These are brand new deals. I just got them this morning. They are amazing. As you see here, we have Dr. Dang, $3,500, breast augmentation with silicone. And then, of course, he has a tummy tuck as well for $3,500. So that was Dr. Dang. Like I said, Moradian is BBLs at $5,000, starting at $5,000. And then we have he has a combo, which is a lipo 360 with a breast lift or reduction. So if you're interested in that combo, you can get that done starting at $7,000. So this is amazing, guys. Take advantage. I will send this here. All right, so if you want to, and like honestly, guys, do this now. Lock in these prices because they are brand new. I know they're only for Christmas. They're going to change, guys. It's already the new year. All right, so I know these prices are going to change. They're going to go higher, so take advantage. Send us your full name and number here in the box, as you see. Full name and number. I will personally make sure that a coordinator contacts you so that you get your free consultation. All right, completely free consultation. You have nothing to lose. Take advantage. You can get this free consultation in person or done virtually. If you are not in Miami, that is totally okay. All right, so as I said, we're talking about these amazing deals, these amazing discounts. We have we talked about Moradian's, his BBL. He has the lipo 360 and breast lift or reduction combo. That is great. We have Dr. Gurani as well. So we have Dr. Gurani's BBLs starting at $5,000 as well. Okay, so his BBL starts at $5,000. And then he has a tummy tuck. So if you're interested in any of these procedures, like now's your chance. literally now is your chance. Get these deals, book in these prices. He has the tummy tuck starting at $4,000. All right, so Guarani, BBL 5,000 and tummy tuck 4,000. So that is what we have for Guarani. Those are his Christmas specials. All right, like I said, only for Christmas, so take advantage. All right, perfect. We have Fisher, or we also have Dr. Fisher. Okay, guys, I will say, let me take a little pause here. All of our doctors are amazing. They're very talented, very experienced. They have over 15 years of experience. They are amazing, okay? You can take a look at them on our IG page. You will be able to see all of their work and their results. You'll be able to see them there. And then of course, go from there, choose which one best aligns to what results you want, what you like. And then based on that, choose your doctor, all right? So that being said, we have Dr. Fisher, all right? His BBLs are starting at 5,500. 5,500 for Dr. Fisher's BBLs, only for Christmas, all right? That is amazing. Take advantage. I know they were a little bit higher, so take advantage. Dr. Fisher, 5,500 BBL. And his Lipo 360 is starting at 5,000, all right? So BBL and Lipo 360 for Fisher. And then I will take a moment to say this. If you get a Lipo 360 or a BBL, you will get 2 massages for free, all right? So 2 free massages with the BBL or the Lipo 360, which is insane, okay? Take advantage. You can get, guys, we have so many things for Christmas, okay? We have so many special deals for Christmas, so take advantage. Like I said, we have the 2 free massages with the BBL or the Lipo 360. And then I will say that just for Dr. Fisher does have 2 areas of lipo for free as well with the BBL or the Lipo 360. Okay, so like literally you're winning from everywhere. You're winning from all over the place because these prices are just amazing. These discounts are amazing. These deals are great, so take advantage. Okay, so like I said, Fisher, you get 2 free areas of lipo for free with the BBL or the Lipo 360. This is only for Dr. Fisher. All right, perfect. So let's talk about Dr. Porter. All right, so hopefully you guys have seen her on live with us as well. She's very sweet. Hopefully I will have her on tomorrow as well. So Dr. Porter on tomorrow, if everything works okay, it works fine. Her BBLs are starting at 3,300. That is insane, all right? 3,300 for her BBLs just for Christmas. All right, that is great. And then of course she has a mommy makeover on discount as well, which is 5,675. Guys, literally take advantage. Mommy makeover, if you guys do not know, it is 2 procedures in one. If you want me to explain what exactly these procedures are, I will go ahead and do that. Let's go through these deals and then I will get back into that. Okay, perfect. So we have, like I said, Dr. Porter, her BBL is 3,300 and then her mommy makeovers are 5,675. All right. Okay, perfect. Now let's talk about Dang. As you guys know, you saw him on this morning. Amazing. He's awesome. He is very good, very talented, very experienced, and of course, he's coming with amazing deals this Christmas. Okay, so let's talk on Dang again. We have his breast augmentations. If you want saline, it is starting at 2,800. If you want silicone, it is starting at 3,500. And if you're looking for a tummy tuck from Dr. Dang, it is also starting at 3,500. All right, so take advantage, guys. Take advantage. This is amazing. These are brand new, like I said, brand new deals. So do this now. I will send this again. lock in these prices. Lock in these prices here, okay? Full name and number, and a coordinator will contact you. So if you're interested in any certain procedure, go ahead and right here is your chance, okay? Full name and number, a coordinator will contact you, and you will get that free consultation. All right, so completely free consultation, amazing with any of the doctors. Just let them know who you're looking into and then go from there. All right, guys, perfect. So we have what if you want, what if you're a lady, okay, and you want something down there fixed, okay? We also have options for you for our intimate area for us ladies. I know that Kiki, hello. Man, I should have waited to book to get this deal. Let me know what you got or what you're getting. I want to know what procedure you're getting. And then I will say, of course, it totally depends on the doctor you choose, and then you specifically what you're getting done, all of that. So hopefully you were able to get all that figured out. But I would love to know what you're getting or what you're interested in getting and with who. All right, so who you booked with. That is awesome. So I was talking about our intimate area down there. So I know that can change as well as we age, pregnancies, all of that fun stuff. That can change as well. So we have options for you. We have Dr. Giselle Garani. Okay, she is amazing. She is a sweetheart. She's just great. Okay, so if you're interested in something down there, all right, we do have options for you. We do have her labiaplasty starts at $2,000, and then her vaginoplasty, I can't say that, oh my gosh, I can't speak today, at $3,800. All right, so $3,800 for that procedure. So if you're interested in anything down there, like I said, please let us know. You will have options. Kiki says, I'm getting a BBL procedure with Dr. Fisher. Okay, well, that is awesome. That is awesome. I do know he is great. He did, I don't know when you booked, but he did have a few extra specials on there too. So I know you were able to get those. So hopefully that will help. If not, talk to your coordinator, see if they can do anything about it. Okay, I'm not too sure if they can kind of like help you out there. But let them know because I will say with, where was it? With Fisher, his, where is he? BBLs is starting at $5,500 this December or this Christmas. All right, so please let them know if you're interested, and then see what they can do for you. All right, I just recently booked in October. Okay, so just let them know. Hopefully you're able to get something fixed. Okay, but I do know, like I said, it totally depends on you what exact procedures you're getting and all of that. So just speak with them. Hopefully they can help you out there. Okay, so guys, we talked about Giselle Garani. All right, and then we have Zong. Are you guys interested in Dr. Zong? He has amazing deals as well. He has his BBLs starting at $3,500. $3,500 for Zong's BBL, starting at that price. So if you're interested in Dr. Zong, please go ahead and book these prices. You're so welcome, Kiki. I really hope they're able to help you. I hope you're able to figure that out, okay? But like I said, I know it does depend on exactly what packages you're getting and all of that, all right? So hopefully they're able to help you out there. And then we have, so Zong, like I said, his BBL is $3,500, and then he also has a Lipo 360 deal this Christmas that is starting at $3,250. So BBL $3,500, Lipo 360 $3,250. So that is Dr. Zong. If you're interested in Dr. Zong, please go ahead and let us know. He is in the new location. All right, so if you want to, go ahead and go to the new location in Hialeah. He is there. Perfect. So we have, last but not least, we have Dr. Harrell. He has amazing deals as well. So if you're interested in Dr. Harrell, he has Lipo 360 starting at 3,700. All right, so that is the Lipo 360, 3,700. And then he has, of course, the BBL starting at 4,000. So that is awesome, guys. Amazing, amazing, amazing. Take advantage. I went through the list of each doctor's specials for Christmas. Take advantage. All right, like I said, do not miss out. Do not miss out on these Christmas deals, just because I know the new year is coming and prices are going to change. Okay, so do that now. Block in these prices, and then of course get your free consultation, and then you are able to speak to your doctor. So there in the corner, all right, there in the corner you see the little arrow. Go ahead and click that arrow and then send us your that is a DM. You're going to send us your full name and number, and then a coordinator will contact you. All right, perfect. So if you guys want to know about our procedures, let's explain them. Okay, so let's start with the BBL, just because it is the most popular. All right, so BBL, super popular here in Icon Cosmetics Center. We pride ourselves in our BBLs, just because honestly, so I moved to Miami and I was like, oh my gosh, everyone has BBLs, but most of the time it looks natural. Like you can't even tell, you cannot tell. It just, depends of course on what you want. So if you want something natural, if you want something very proportionate, that is totally okay. If you're looking for something a little bit more extravagant or bigger, whatever it may be, that is totally fine as well. Like I said, just make sure you talk to your doctor, that they know what your goals are, that they know what what results you're looking for. And then of course, please have realistic expectations as well. We love it when our patients have realistic expectations, just because, as you guys know, everyone is different. All right, everyone is different. You can't expect to look exactly the same as someone else who has a completely different body than you to start with. All right, so just have realistic expectations and know that you're going to see results. They're going to deliver the results. Of course, you're going to look amazing. Just know that you have to have realistic expectations, because like I said, everyone is different. Everyone's anatomy is different. Everyone's body is different, right? So that is perfect. BBL, what is it exactly? Perfect. So what exactly is a BBL? A lot of people think that they need to add on the Lipo 360 in order to get that shape, but I will say, for the BBL, you have to have the Lipo 360 done first, because it is included. All right, so as you guys know, they have to take the fat from somewhere, so they're going to perform a lipo on you, and they're going to target 12 areas. Okay, so they're going to target the abdomen, the waist, and the lower back. All of this area is going to get targeted. They are going to extract all that fat from this area, and then they are going to inject it into your glutes and your hips. Perfect. So glutes and your hips. If you have hip dips, I know a lot of ladies have hip dips and they don't like them, and they can't get rid of them, unfortunately, by going to the gym or anything like that. So a BBL could be a good procedure for you, just because it does fill in those hips. It gives you a nice round, very shapely bottom, glutes area. So if you're looking for a BBL, this could be something that you're interested in. Okay, so like I said, it's going to give you a nice tiny waist because of the lipo. So you're going to get all that fat extracted, giving you a nice small waist. And then of course, when it gets injected into your glutes, it is going to make you look like this. Okay, very nice feminine hourglass figure, which is great. So if you are looking for that result, honestly, who isn't? Which woman is not looking for that result? I do not know. I personally do not know any of them. So if you want that feminine hourglass figure, like I said, then take a look into a BBL, of course, because like I said, small waist, bigger hips, and glutes. Perfect. All right, so like I said, we do have amazing specials For that, we have amazing specials for Christmas for the BBL, and then you can get it starting at 3,300. This is just for Christmas, okay? So BBL starting at 3,300 just for Christmas. Take advantage. Take advantage, and then book your BBL. All right? Perfect, guys. Let's take a second to remind you guys the giveaway. All right, today was the last day. And the cutoff, guys, is today. All right, so I'm sorry if you missed it. You missed it. I am so sorry. I told you multiple times. I couldn't stress it enough. Okay, so I hope you were able to enter in the giveaway. I hope you were able to tell all your friends and tell all your family, and of course, hopefully, you are that winner. So good luck. We are going to be announcing the winner today at 3. If everything works according to plan. Okay, so stay tuned for that. We're going to be announcing the winner of our iconic giveaway, and they're going to be winning that free procedure, which is awesome. All right, so like I said, I'm super excited to see who wins. I'm super excited to see what happens and what they choose. So if you entered, good luck. Okay, so they will be announcing the winner today. Perfect. So we talked about the BBL. Let's talk about the Lipo 360. Who is a good candidate for the Lipo 360? All right. So what if you are just someone that wants to lose weight? What if you're just wanting to lose weight? Is a Lipo 360 right for you? All right. Well, I will say this could possibly not be a good option for you if you're just wanting to lose weight. Okay. Why? Because the Lipo 360, what it does is it targets localized fat. So if you're just wanting to lose weight, this is not a good option for you. Okay, probably not a good option for you, as it targets this fat, this localized fat. So if you have that stubborn fat in this area or whatever it may be, then maybe that is a good option for you. Okay, so personally, the Lipo 360 is my favorite because it is something that I've been wanting to do for a while. Hopefully I get that done. We'll see. So the Lipo 360, it targets 12 areas. All right, so 12 areas in your abdomen, your waist, and your lower back. All of this area here gets targeted with the Lipo 360. They're going to extract all that fat. All right, they're going to extract all that fat, and then it's going to give you a nice small waist. It's going to give you that tiny waistline. It's going to make you look snatched and amazing, and who does not want that? I feel like everyone can use a little lipo, honestly. All right, so I speak on lipo and then BBL because so real quick, Lipo 360, it is starting at 2,800, guys. This is only for Christmas. 2,800. These are brand new deals. Okay, brand new prices. 2,800 for a Lipo 360. That is what it is starting at. So take advantage. Take advantage and then get your procedure done. So why do I mention the BBL and the Lipo 360? Because if you get either of these two procedures, BBL or Lipo 360, you are going to get 2 free massages. 2 free massages. Insane with a BBL or a Lipo 360. So take advantage. All right, so I'm gonna send this again here. Full name and number. Okay, full name and number, and you are going to get a call. So make sure you answer that. Make sure you make sure you answer the phone for that, and of course you're going to get that free consultation. All right, so free consultation. You have nothing to lose. Go ahead and book now. Get these prices in. Lock in these prices. Awesome. So like I said, BBL, Lipo 360, 2 free massages, which, as if you hopefully you saw Dr. Ding on this morning, he was saying how important these massages are. All right, so do your massages. Very important, and then you're going to get 2 free massages with that BBL or Lipo 360. And if you choose to go with Dr. Fisher, he does have 2 areas of lipo for free with either the BBL or the Lipo 360. So Either way, you can't go wrong. We just have so many things, so many deals, so many like specials to offer here in this Christmas. So take advantage. All right, take advantage. And then guys, something I haven't spoken about, I don't know if you guys were able to see, we also have, just for Christmas, we have 50% off on our post-op bundles. All right, that is amazing. Of course, as you guys know, you're gonna need your accessories, you're going to need your compression garments, your fajas, your boards, your, you know, all of that. You're going to need this. So we do have bundles post-op for you, and they are at 50% discount for this Christmas. Take advantage. Literally, we have so much to offer. We have so much, guys. Like, I don't know if you're not booking right now. I don't know why. I don't know how you can resist. But honestly, it is an amazing opportunity. Go ahead and take advantage. Take advantage of these prices, of these bundles, and of these specials. All right, so like I said, bundles, post-op care, we have that 50% off. You can take a look at them more in more detail on our IG page. So you can take a look at us at them there. And then guys, so we talked about the BBL, we talked about the Lipo 360. Should we talk about the mommy makeover? Let's talk about the mommy makeover. All right, so who's a good candidate for the mommy makeover? Well, as the name suggests, okay, moms are a perfect candidate. You do not have to be a mom, just clearing that out there. Like, you don't have to be a mom to be in order to qualify for this procedure, but it is special for moms because why? As you guys know, during pregnancies, childbirth, all of that, your body changes, okay? It changes a lot. And you know, most of the time not in the best way. Not in the best way. It just happens like that, okay? This is what happens with our body. So the mommy makeover targets 2 procedures. Okay, it is 2 procedures in one. It targets 2 areas that get affected with this, with childbirth, with pregnancies, which is the chest area, the breast, and then of course the abdomen area. So it is 2 procedures in one. Like I said, it is the breast area. Typically it comes with a lift, okay? So typically it just comes with a lift, but you can get anything that you need, all right? So if you want a lift, if you want a reduction, if you want a augmentation, or if you want a lift with implants, that is okay. You can definitely get that done. You just have to let your doctor know, and they will be able to adjust accordingly, and of course be able to help you there. And then of course they're going to see you, they're going to help you decide and guide you better. All right, so like I said, it comes with mommy makeover, typically a lift, or you can get a reduction, a augmentation, or a lift with implants. Honestly, whatever your body needs, okay, you will be able to get that here in this area. And then of course it also comes with a tummy tuck. All right, perfect. So like I said, 2 procedures in one, chest area, breast, and then a tummy tuck procedure. You can get a tummy tuck, which is as you guys know, during pregnancy, right, your belly expands during that, you know, after you have your baby. Sometimes the skin doesn't bounce back, all right? That is just how we are built. Unfortunately, sometimes you will be left with that loose, flaccid skin, and that is not what we like, right? We do not like that extra skin there. So what happens during a tummy tuck? They remove all of that excess skin. They're going to remove all of that excess skin, and they're going to pull it down, tighten you, and then of course it is going to give you a very nice, smooth, tight look. You're gonna look amazing, and it's going to make you look smaller. Why? Because also with the tummy tuck, apart with it being 2 areas of lipo in that area, as well with the tummy tuck, you will also get your muscles repaired. So during pregnancy, as you guys know, your muscles expand change depending on the person. It could be a little bit, it could be a lot. That totally, just depends on you. But during the tummy tuck procedure, they are going to tighten them. They are going to pull them back to where they should be in the first place. And that's already going to, make you look a little bit smaller, give you a smaller waistline, and then you could look better than what you looked like before your pregnancy. So that is awesome, okay? You are going to look snatched. You're going to look amazing. You're going to just rock it, okay? So you're gonna get rid of all that excess skin. You're going to get your muscles tightened, and you're going to get a breast procedure. So honestly, that is a mommy makeover. That is amazing. And I will say, for Christmas, we do have this on special for starting at $5,675. All right, so that is what it is starting at. If you are interested in the mommy makeover, that is like a legit transformation, okay? That is awesome. So go ahead and send your full name and number here, full name and number, and I will personally make sure that a coordinator contacts you and that you get your free consultation. All right, so you have nothing to lose. Free consultation. Book in these prices, lock in these deals, because they are amazing and they are going to leave. All right, they're going to be gone and you're not going to see them again. So do this now. This is just for Christmas, all right? So if you missed that bar, here in the corner, you will see the little arrow, and then go ahead and click that. Send us your full name and number there. That is the DM, so you can do it like that. Perfect. So we talked about the mommy makeover. Let's talk a little bit about something that I don't really talk about too often. What if you're a man? Okay, so we have male procedures, okay? So if you're a man and you have, for better lack of words, man boobs, if you have extra tissue in your breast, this could be something that bothers you, okay? I hear it is very common in bodybuilders, things like that. So if you have this issue, if you have this breast tissue, excess breast tissue, and you're a male, this could be bothersome for you. So we do have an option for you. So we have a lipo with the gynecomastia, which is what I was explaining. If you have this extra breast tissue for males, they are going to remove all of that extra tissue. So that is called the gynecomastia. If you are interested in that, it is coming with a lipo for $5,175. All right, that is insane. That is amazing. $5,175 lipo and gynecomastia. So if you're interested, please go ahead and let me know in the comments, and then send us that DM. Perfect. All right, so guys, I think I'm gonna pop off now. Thank you guys so much for being here. Thank you so much for joining us in the morning with Dr. Dang. He was able to answer your questions, address your concerns. He was very, very good. He's amazing. Okay, so hopefully you were able to see him. If not, he will be on live again soon. But for tomorrow, hopefully Dr. Porter will be on. So make sure you're following us here. Make sure you're following us so you do not miss these lives. That'll give you a chance to talk to your doctor. So that is awesome. You'll be able to speak to your doctor directly and ask them your questions and have them address any concerns. Perfect. So thank you guys so much. As I said, winner will be announced today. All right, winner will be announced today at 3 on live. So please make sure you do not miss that. Winner will be announced. I am super, super excited. All right, so thank you guys so much. Have a wonderful rest of your Tuesday. I will see you guys later.